Hello, I'm Dr. Heiner. If you're watching this video clip, it's because you're interested in learning about the PSA or prostate blood test. And first of all, I think it's important to know what the prostate does, and so I'm going to define that first. The prostate gland sits right here below the base of the bladder. The bladder is where we store our urine, and when the bladder fills up, it squeezes the urine through the urethra and out the penis to the outside world. This piece of tissue right here at the base of the bladder is the prostate gland. It has its purpose is to make semen. So the fluid that comes out when men ejaculate, that the sperm swim in, is made by the prostate gland. The prostate can cause two problems. As we age, it gets bigger and bigger, and as it increases in size, the passageway we urinate through gets more and more narrow, and it becomes increasingly difficult to urinate. That's why there's a lot of medicines and procedures that can potentially open up the prostate and help people empty their bladder better. The other thing that could happen is the prostate could develop cancer, and all men, if they live long enough, will develop prostate cancer. Now I'm going to tell you a little bit about the PSA, or Prostate Specific Antigen prostate blood test. That's a test that your doctor checks because prostate cancer makes extra PSA, and if the PSA is too high, it could be the first sign of there being a problem with prostate cancer. Prostate cancer doesn't cause any symptoms until it's very advanced, and the best way of detecting it early is with a PSA, or Prostate Specific Antigen blood test, and a rectal exam. The rectum is right here behind the prostate, and if we put our finger in the rectum, we can examine the back surface of the prostate and feel if there's any abnormalities or lumps. The prostate specific antigen is made by the prostate, but it can occur in higher levels in situations other than when a man has prostate cancer. For instance, the bigger the prostate gets, the more PSA your prostate should make. So if your PSA is if your prostate gland is twice as big as the next guy's, your PSA should be twice as high. Other things that can cause an elevated PSA level include inflammation or infection in the prostate. If the prostate has a degree of obstruction and there's some difficulty urinating, that can cause the PSA to be elevated a little bit. And also, some studies suggest that if you get your PSA blood test drawn within a few days of having ejaculated or having any sexual activity or having had a rectal exam, that could also slightly increase the PSA level. Now, the PSA, the prostate specific antigen protein, is not a toxin, it's not a poison, it doesn't cause any symptoms. So the PSA can be very high, and men don't know it. They just feel as if they would if their PSA were low. So it doesn't cause any symptoms, and it's used as a screening tool. If your PSA is elevated, the question is, do you need a prostate biopsy? And that's a whole nother discussion. The more you listen and learn about prostate cancer, you'll realize that it's quite controversial, and that'll be the topic of another video clip. If your PSA has been elevated, it might be reasonable to set you up for a prostate biopsy, which is how we discover prostate cancer. Right now, it's the only way we have of diagnosing prostate cancer is with a biopsy. Other options would include checking it again after a period of time or a couple of months have gone by. Sometimes we'll put people on a prostate relaxing medicine that's designed to help people urinate better, but we do that with the goal of seeing if it will help the PSA number come down. So some people will take that medicine despite the fact they don't complain of any urinary symptoms or difficulties. They'll take the prostate relaxing medicine in the hopes that their PSA will come down into the normal range. So that's a discussion that you can have with your doctor or your urologist.